Now, apparently, all you need to become a nurse is being young, being a female, though rare occasion I get to see some males too, and just done with WAEC, no jam, no school of nursing, just straight to injection duty. Before I say anything, watch this video.
Yes,
Eh?
yes.
Okay, so tell us what you do in Skylink.
The general treatment, malaria, typhoid, and infection treatment.
You carry out surgery.
Yes,
What kind of surgeries do you do?
appendix. Yes.
How many people have you attended to? Because I see you have more than 200 cards here, patients.
This is the first one I tried. I have worked somewhere as a nursing assistant.
Where?
The Jones Hospital at Ojokoro along Ikorodu Road.
How long did you work there?
2 years or 2.5 years.
There's a certificate here that says 2021.
It's a forged certificate. Obafemi Awolowo, MBBS, medicine and surgery. Nobody taught me, but I used to help my clean the stomach with antiseptic. You clean with antiseptic and Dettol with water. So after that, then you give some anesthetic injection before starting the surgery.
When you start surgery, what do you do now?
Surgical blade
To do what?
to dissect the stomach. It's appendix. After opening the stomach, then you cut the appendix. After cutting the stomach, then you suture the appendix and suture the flesh, fat, and the skin. Then you pack it with gauze and apply plaster. I have only SSC.
From what school?
SSC.
From what school?
From
Hospital owners, this is for you guys. Now, this is it here. If you watch that video closely, the guy said he has only SSC. That's what many of them do once they're done from secondary school, straight into it, right? And then he said the program was for 2.5 years. Yeah, that's the ideal time many facilities also used to, right? What many of these hospital owners what they do basically is that they employ these persons and then they start teaching them. You get telling we doctors to teach them, they observe procedures, and funny enough, these people, they tend to even have more skills than the young medical doctors. This is it here. I used to work in a facility where we were like 3 doctors that the hospital owner employed, and then anytime a patient comes in, the nurses get to come inside the consulting room, and then they are listening, watching while consultation is going on. So there's this colleague of mine that he normally sends them out. He sends all of them out. I'll be like, guy, have fun now. Why are you doing? Why are you always sending these nurses out? He'll be like, these things are wrong. A nurse, what is a nurse doing in a consulting room? At least the nurse attention would be needed in the consulting room if you need a chaperone and you are handling a female patient, and that's when you want to do a physical examination on the patient. I was like, yeah, that's true. That things like this get to promote quacks and all of that in the system, because when these people finish from this 2.5 year program, I don't know what to call it, they go out there and start committing nuisance, you get. And funny enough, these are the people that after like this guy now, after he has committed havoc, he will now refer the patient to a teaching hospital, you get, because that's what they do. At the end of the day now, the patient will die in the teaching hospital. Those same people, the patient relatives will start saying that, the teaching hospital killed this person. Do you get? So you go back to my video where I talked about teaching hospitals, you understand what I'm trying to say here, right? So at the end of the day, when this guy started making me understand these things, I was like, okay, that's really true. He's so not wrong about this. But don't me personally, I don't do that, because these people pay. When they told me the amount of money they pay to learn this thing for 2.5 years, I was shocked. So basically, to the hospital owners, they are just trying to make money, right? After all, the hospital business is all about money. So, but what I would want to advise is, if they can actually talk to these people to encourage them to go to school of nursing, get the RN degree, right? And then if you can't go to the university to get a BSc in nursing, at least the RN is also well respected. in the country. Do you understand my point? So I know many of the hospital owners, particularly those ones that are not medical doctors, they like to feast on things like this because they don't want to pay a registered nurse or a nurse with BSc degree. They feel paying them what was the essence paying them in the center where I am currently now. Before I say Jack, that there was a day a patient came in that was supposed to lose his stitches. I was even just prepping myself to go to the theater to do that. One of the nurses just came that, Chief, we are done. Oh. I'm like, what? Are you serious? And then only for me to get to the theater, it was done neat and clean. Another thing that I was not happy about is that the news media guys, I'm not happy with them at all. They ought to have censored the part where the man mentioned the name of the hospital. That's the truth, because many persons in that area now would think that hospital breeds quack. So they would have censored that part. It's not a good one on them. Hospital owners, I would beg, you can liaise with these nurses with BSc. Do you know that some of these nurses that I've worked it somewhere, that someone that went to learn things like this, because she was so good at it, they were calling her matron. She was even trying to oppress me because I was a young doctor then. Like, if I give orders, she will counter it. Like I always say, Nigeria can only get better when we do things the right way. That's the honest truth. So please and please, hospital owners, this is a call to you guys. Please try your best. I know it's really not easy. The nurses that went to school, that has the BSc, the RN, and all that, they might want to charge you more. But is it not better you have like 2-3 standard nurses in your facility than having like 20 nurses doing 2.5 years, and at the end of the day, when they leave your facility, they go out there and start committing havoc, killing people for free. Now, this guy now was apprehended because I would want to think that that person he worked on died. That's why he was apprehended. You can imagine. And one thing that is common with them is that they will tell you that that's their first time of doing it. Now, I could hear from that video too that the woman, the interviewer, was saying, but you have over 200 and something forms here, and you are saying it's your first time. You can imagine, right? So please and please. And the painful thing is that Nigerians get to these people first. That's the thing. I don't know how they do it. Without no even advert, nothing. They just get all these people. Meanwhile, they get people that are good at it, they don't get to see them. They only come when it's dying minute, expecting us to now do the magic. No Gaza.
Now let me pray for you. Father, in the name of Jesus, I stretch my hands over your blessed people here on ground and connecting across